Hello everyone. Once again welcome back to another session of Community Health and Social Work. And now you are watching UN College Digital Class YouTube channel. In our previous video lecture, we had discussed about the three-tier system of healthcare, and also we had discussed about what is medical care, what is health care, and also discussed on what are the different three-tier level of healthcare. Like in primary level, there is primary health centers. In secondary level, there is community health centers and district hospitals, and in tertiary level, there is medical college hospitals. And we had already discussed about the primary health care or primary health centers and objectives of primary health center, functions of primary health center, what are the facilities available in primary health center, what are the staffing pattern of primary health center, and also discussed about how we can get different facilities in primary health center. Let's discuss on another level, that is secondary level, and under secondary level which we will discuss in this class, that is the community health center, and also we will discuss on the sub centers, and we will discuss about the objectives, the functions, the role of nurses, the staffing pattern of community health centers, and how we can get facilities from the community health centers, and what are the facilities available in community health centers and sub centers also. Let's discuss on briefly about community health center and sub centers. First, we will discuss about community health center. First of all, what is community health center? Community health centers are being established and maintained by the state governments. It has 30 indoor beds with one operation theatre or OT, X-ray, labor room and laboratory facilities. It serves as a referral center for 4 PHCs. It means all the community health centers are established and maintained under the state government, and in every community health center there need to be 30 seats, one operation theatre room, one X-ray room and one laboratory also. And under every community health center there is 4 primary health centers. It means 4 primary health centers are referred their patients to the community health center, under which community health center the PSCs is going. And also, when in primary health center, if a patient is not curing or not getting proper treatment, then we can refer that patient to the community health center. Provides facilities for obstetric care and specialist consultations. And also community health centers are providing obstetric care. It means basic obstetric care was defined as care for a normal delivery and referral if complications occurred. We define delivery related perinatal mortality as intrapartum death or neonatal death within 24 hours at a gestational age of below 22 weeks or at 22 weeks, or birth weight of 500 gram or below 500 gram. And also in community health center, these centers are providing specialist consultation on specific diseases, like there is specialist for medicine, there is specialist for gynae problems, and there is specialist for other issues. And next is each community health center covering population of 1 lakh, and in between 1 lakh population, one CSC or one community health center are functioned. And next is objectives of community health center. What are the facilities? What are the major role of community health center in community? To providing routine as well as specialized healthcare services. And community health center, the health workers, those who are working in community health center, they have objective for providing the routine treatment or specialized healthcare services for them, those who have need of healthcare service, and to making adequate provisions for referral services also, and also providing the provisions for referral services like those patients who are referred from the primary health centers to the community health centers, the community health centers have to find out what are the provisions, what are the facilities are needed for the referral patient, and they have to recognize the actual problem of that patient and providing all the facilities to that referral service or to that referral patient. And next we will discuss on what are the functions of community health centers: regular outpatient services and inpatient services. The community health center have to provide the regular services for inpatient and outpatient. It means inpatients, those who are already admitted in the community health center, and outpatient means those who are came from the outside of the hospital. And the community health center have to providing all the facilities which are needed for the inpatients and which are needed for the outpatients, and they have to maintain regular checkup of the inpatient and outpatient services, and comprehensive family welfare services. And this is another function of CHC, like they have to aware the people about family welfare services and what are the services which are needed for a family welfare, like they have to aware about the family planning objectives and methods to the couple, those who are going to the community health center for checkup related with maternity or related with pregnancy, and maternal and child health services. And also the another function is maternal and child health service, like at the maternity period which facilities or which services are the needed which at the maternity period, and also they have to give emphasis on the child health services, like at the childhood period what are the services are needed for that child also. And in childhood period there is necessity of immunization, there is a necessity of other hospital services, and at the childhood period there is a requirement of polio and other BCG and other tikas, other immunization services. And at the maternity period there is also necessity of medications like folic acid, iron tablet, and proper checkup at proper time gap, and what are the objectives they have to follow at the maternity period, what are the services, what are the nutrition are needed for the maternity period, and also what are the nutrition are needed for at the childhood period also. The community health center have to aware, have to give knowledge and share knowledge about the maternal health and child health services. Next is laboratory services. It means under community health center there is facility of laboratory service, like in laboratory service there is facility for stool test, urine test, and blood test also. And under blood test, diabetic test, thyroid T2, T3, T4, TSH test, and under stool test there is also some other tests which are needed for detecting a patient is suffering from which disease, and there is availability of laboratory services in community health centers. And the next is X-ray facilities. In community health center there is facility for X-ray, because nowadays so there is major cases are accidental, and also some patients are suffering rheumatism, spondylitis, arthritis, different types of disease, and which patients have need of X-ray, and in CSC there is X-ray facilities are also available, or also another function is X-ray facility. Then is national health programs, and under government there is different programs are published or established for the people, and through which the people can aware about different national health programs. And under national health program, these programs are like Ayushman Bharat Yojana, Pradhan Mantri Swasthya Suraksha Yojana, then is Labor Room Quality Improvement Initiative, National Health Mission, National Digital Health Mission. These are some health programs which are working under National Health Program. And under the Labor Room Quality Improvement Initiative, there is a facility for the patients, or for at the time of maternity period or at the delivery time, for that woman, and the doctor or the medical had to improvement in initiative for labor room quality, and all the facilities which are needed at the delivery time, all the facilities had to produce for the patient. And also there is National Health Mission and National Digital Health Mission, and under national health programs there is ambulance facilities, 102 ambulance and 108 ambulance for patients, which is providing emergency services through free of cost. And through these services the people are also getting many emergency care. Then is immunization services. Under immunization services there is different immunization like BCG at birth or as early as possible till 1 year of age, and another is hepatitis B birth dose at birth or as early as possible within 24 hours. Then is OPV birth dose at birth or as early as possible within the first 15 days. Then is OPV 1, 2 and 3 at 6 weeks, 10 weeks and 14 weeks. Then is IPV inactivated polio vaccine 14 weeks. Then is pentavalent 1, 2 and 3 at 6 weeks, at 10 weeks and at 14 weeks. Then is rotavirus vaccine at 6 weeks, 10 weeks and 14 weeks. Then is measles first dose 9 completed months, 12 months, give up to 5 years if not received at 9 to 12 months age. Then is vitamin A first dose at 9 months with measles, and DPT first booster 16 to 24 months, OPV booster 16 to 24 months, measles second dose 16 to 24 months, vitamin A second to 9th dose 16 months with DPT, OPV, BC and 1 dose every 6 months up to the age of 5 years, and DPT second booster 5 to 6 years, and TT 10 years and 16 years also. These are the immunization services for the children. And next is provisions for safe drinking water. Now, also in community health center there is availability of providing safe drinking water for the patients, because for maintaining a healthy life there is a necessity of pure drinking water. Then is basic sanitation. In hospitals there is need of basic sanitation or hygienic environment, and the medicals have to maintain the sanitation which are very necessary for the patients, because through unhygienic condition, through unsanitized area, some patients are suffering from different infections and different other diseases also, because at the time of any issue or at the time of any disease, the patients have the immunization power is very low, and if there is any infection they can infected very quickly. Due to that the hospital have to maintain basic sanitation. Next is prevention and control of endemic disease, and also prevent and control different endemic diseases which are not contaminated from one to another person very quickly or directly contact. And endemic diseases are not epidemic or not spread from one person to another person, and the community health center have to prevent and control the endemic diseases. And next is collection of vital statistics of the area, and also collect the vital statistics data, like the community health center have to collect data on maternal mortality, child mortality, infant mortality, birth rate, death rate, because through these data we can know about the statistics of the population. And health and nutrition, and also providing knowledge on health and nutrition, which type of nutrition is necessary for children, which type of nutrition is necessary for women, which type of nutrition is necessary for the main person, and which type of nutrition are necessary for the old age person, and through which the people can maintain a healthy life. And nutrition is very necessary as an important part for maintain a healthy life. Next is education and training of various health, and also providing education and training on different health related issues and different health related programs and immunization services also. And, next we will discuss about the staffing pattern of the community health center. In community health center, there is a medical officer existing 4 and IPHS proposed for 7. Nurse midwife or staff nurse existing 7 and IPHS proposed for 9. Then dresser existing 1 and IPHS proposed for 1. Then is pharmacist or compounder existing 1 and IPHS proposed for 1. Laboratory technician existing 1 and IPHS proposed for 1. Then is radiographer existing 1 and IPHS proposed for 1. Then is ward boys existing 2 and IPHS proposed for 2. Then is dhobi existing 1, there is no proposed. Sweeper existing 3 and also proposed for 3. Then is mali 1 existing, and chowkidar, aya and peon also existing, number of them are 1. And OPD attendant, there is IPHS proposed for 5 attendant, but no existence of OPD attendant. And OTID attendant also, which depends upon the different CSCs. And ophthalmic assistant necessity or proposed for 1, but there is in community health center there is no ophthalmic assistant. And existing are 25 health workers and proposed for 31 numbers of health workers. Next is, what is the role of nurse in community health center? The role of nurse is care provider, organizer, quality control, problem solver, educator and advocate. These are the role of nurse in community health center. If a woman is working as a nurse in community health center, then she has to maintain all these criteria, because a nurse always taking care of the patients rather than the doctors. The physician or the doctor will advise the medications or prescribe the medications, but the nurse has to maintain all these things, and the nurse has to maintain the quality, and the nurse have to solve the problems of the patients, and also motivate and educate the patients, and also sometimes advocacy for the patients if the patient is suffering from any disease, or if the patient is mentally not strong, then the nurse has to advocacy, or nurse has to motivate or counsel the patients. And next is soft center. The soft center is the peripheral outpost of the existing health delivery system in rural areas. The soft centers are working in mainly in rural areas, and next is, they are being established on the basis of 1 soft center for every 5,000 population in general, and 1 for every 3,000 population in hilly, tribal and backward areas. Soft centers are functioning in rural areas mainly, and in general rural areas in between the 5,000 population 1 soft center is established, and in hilly and tribal or backward areas in between the 3,000 population 1 soft center is established for providing healthcare services for the people who are living in that area. And next is, what is the functions of the soft center? First is immunization. The soft center have to aware about people about the immunization services. What are the immunization services? Are providing to the children for eradicating or prevention of different diseases. Then is antenatal, intranatal and postnatal care. At the maternity period, the mother has to take care of herself, and not only the mothers, the other members like the family members and other neighborhoods also, they have to take care of that woman. And the maternity period, there is need of antenatal, intranatal and postnatal care after birth of the child and before birth of the child also, because the before birth of the child, the health situation also needs for taking care of the child after birth. If the mother will not take proper nutrition and proper care at the maternity period, then that affects the postnatal care also. Then is prevention of malnutrition and common childhood diseases, and also another function is prevent the malnutrition and common childhood diseases. In childhood period, the children are facing different types of diseases due to lack of nutrition, due to lack of immunization, and the soft center as role and function is prevent of malnutrition and all the childhood diseases. And the sub-centers have to aware about the proper nutrition which are necessary for the childhood period for child. And if the children, if the parents are aware about the proper nutrition, then they can take the proper nutritious food, then they can maintain the childhood period, and they can also prevent different diseases like malnutrition and other diseases. Then is family planning services, and also aware about family planning services. 5 family planning services is necessary. What are the objectives of family planning services? What are the facilities for them, those who are accepting the family planning services? Also aware about all these facilities. Then is counseling, and also counsel all the people about health and nutrition facilities, how the people can take care of their self, and how they can take care of health, and how they can maintain a healthy life. Counsel on that also. Then is drugs for minor ailments, and if some youth and some people are taking drugs, and they have to aware about the problems which are linked with the drugs addiction. Like education, healthcare should be given importance, and always treat your body and take care of your body as like as it belongs from someone you love, because it is the only place where you have to live. And we have to take care of our health, and through take care of health we can maintain a healthy life. And when we are maintaining a healthy life, there is need of the medical care and healthcare facilities, because we don't know in which time or when we have need of healthcare facilities. Because of that, we have to know about what are the facilities are available in which level of healthcare, like in what are the facilities available in primary health centers, and also we have to know about what are the objectives, we have to know about what are the functions of community health centers also, through which we can get services or we can get treatment at the right time or at the right period of any disease. In next class, we will discuss about some other level of healthcare. Thank you. Keep watching. Have a great day.